Hello, this is Debbie Lin-Toomey, Health and Happiness Specialist. I empower burnt-out nurses with research-proven skills to boost their energy, happiness, and resiliency so they can go home from work feeling good about the work they did and feeling good about themselves. So today is day 2 of 5 of the Nursing Burnout series that I'm offering through Facebook and also LinkedIn. Yesterday was day 1, and I talked about burnout and the 3 components of burnout according to Maslach. And the 3 components being emotional exhaustion, depersonalization, and inefficacy. Today, I'll be sharing with you 4 causes of burnout according to Bakamis et al. And this is information that I got from a peer-reviewed research article. Again, it's by Bakamis et al. And the year is 2019, so it's very recent. But before I share that with you, I just want to share with you a quick burnout story, personal one. I remember being a relatively new grad and working many different shifts. Evening shift, night shift, day shift, 8-hour shift, 12-hour shift, and sometimes, yes, 16-hour shift. And I remember one day being off, this was a weekend, and my husband and I decided to go into town for lunch. And he drove around to look for free parking, which he found one, which is great, but it happened to be a few feet away from where I worked. I remember being so mad at him. I was just so mad because he found a spot, a free spot, but it had to be so close to work. The last thing I wanted to do was see or think about work on my day off after working so hard. See, that I was being irrational, and I felt so badly later on that day, and I apologized to him. So I don't know if you could, if you have similar stories like this, or you can understand, but you know, when you're in such a state of chronic stress or burnout, you just say and do things that you regret because your mind is altered. So now I want to share with you the 4 causes of burnout in this short video. Okay, so this one is from Bakamis et al. And it's a 2019 peer-reviewed research article. And according to this research article, which is so interesting, the researchers categorize the different characteristics of the factors that cause burnout. So the first characteristic is individual. Second one is management. The third one is organizational. And then the fourth one is work environment. So the interesting thing about the individual characteristics, burnout can be perceived differently depending on our age. Now, according to this research, they have found that if you are age 30 or younger, you're more likely to suffer high levels of stress and burnout, and you're more likely to share your emotional feelings with others. Now, if you were older than 30 years old, you reported slightly less rates of burnout, so you still suffered, but you're more likely to hide your emotional feelings. Okay? So older adults, 30 and up, nurses, they still have burnout, but they don't share their feelings with others. Whereas the younger ones, they report that they have burnout and they say that they have burnout, okay? Difference in age. Now, the next characteristic is management. So in management, nurses report feeling burnt out and chronic stress from being mandated to work overtime. So that's also another cause. Now, the organizational one has 2 different components to it. The first one is patient to nurse ratio. Okay, so they said, I'm just going to look at my notes real quickly here, that 7%, there's a 7% decrease in patient mortality for every 1 additional nurse that's added onto the unit. So that's pretty big. That's, I mean, 7% decrease in patient mortality if you just add one more nurse to your staff. That's a huge deal, you know? And they're also reporting that by year 2020, which is next year, the nursing shortage is reported to be going up to about 1 million. Yep, nursing shortage is on the rise, which will further fuel what? Stress and burnout. Then the second component of this organizational characteristic is workload. And again, I'm going to look at my notes real quickly. According to this study, 80% of the nurses report that they have no rest at all. They don't take any break at all, or not able to during their work shift. And also 42% report severe stress, and 45% report that they're tired from their job. Okay. Now, the fourth characteristic is work environment. So work environment can have an impact on our stress and burnout. So according to this research, I'm going to look at my notes again, 34% of RNs feel burnt out from poor work environment, and about 24% of nurses feel that they're not satisfied from their occupation. So they're no longer satisfied with their occupation. So think about these different characteristics that I just shared with you: individual, management, organizational, and work environment. How does that relate to what you're experiencing right now? Does any of what I shared with you resonate with you? Are you a nurse that's 30 or younger? And are you experiencing burnout? And are you able to share the fact that you're burnt out and stressed with others? Or if you're a nurse that's 30 and older, are you experiencing burnout? And perhaps are you not able to label it or not able to acknowledge it? So these are just ways for you to just think about how you are at work and how stress is impacting you. Okay, are you being mandated to work overtime? And how is the nursing shortage affecting the place that you're working in? And do you have time for breaks? Okay, and how's your work environment? Do you have a very nice work environment where everything is nice and clean and you have all the resources that you need? Or do you work in an old place and you have very little resources and everything's falling apart, and you have to keep looking for things because there's a lack of inventory or equipments? So keep thinking about that. And, again, as I mentioned yesterday in day one, that one of the best ways we can start taking care of ourselves and dealing with burnout is to recognize it. The more we're able to recognize it, the more we're able to create healthier choices to take care of it, whether it's taking maybe a day off. A personal day, a holiday, a personal day off. So that way you can give yourself some self-care. Or maybe taking a long weekend off, or taking vacation time off. Or maybe if you are really, really struggling, perhaps thinking about switching to another unit to expand your experience. Or maybe going back to school to learn something new. So there's so many different options. Don't ever forget that you have your peers to talk with, and your family as well to talk with. But again, one of the best things that you could do to help you manage your stress and also your burnout is to acknowledge it. So that way you're able to find healthier ways to take care of it. So that's it for today. My name is Debbie Lynn Toomey. I hope that you tune in tomorrow, where I'll cover more information about nurse burnout and also share with you some techniques that you could do to help you reduce your stress and burnout. That's it. Take care. Bye-bye.